this is a child with, a clinical presentation consistent with Duchenne muscular dystrophy. Most boys get off the floor in less than 2 seconds. So, less than 7 he'll have a Gower maneuver, and it'll be obvious that he can't get off the floor in a normal way. And with that very high CK, most likely has Duchenne muscular dystrophy, and the confirmation is through genetic testing. I'm fine with getting an echo, but it's not the most urgent thing, in my opinion, in this asymptomatic, from a cardiac standpoint, boy with a mild high troponin. And we can get back to the troponin in a bit. The genotyping is not just for the diagnosis, although that is a critical part, but actually now in the era of gene modifying therapy, knowing the specifics of the genetic mutation is really critical to making treatment decisions for the family. The dystrophin gene is the largest gene in the body, 79 exons, and there are a variety of different genetic mutations that cause disease. So it's all in the dystrophin gene, but you can have a problem anywhere along those 79 exons and have Duchenne muscular dystrophy. If you have a mutation in a certain place in the of those 79 exons, if you have a particular type of mutation that disrupts the reading frame, meaning that the protein can't be made from start to finish, some of those mutations are candidates for FDA-approved antisense oligonucleotide therapy. There are 4 FDA-approved therapies, but they are gene specific. So not every boy with Duchenne is a candidate for ASO therapy. You have to have a mutation where these ASOs are targeted. And if they are targeted to that particular mutation, then they can take an out of frame mutation and convert it to an in frame mutation so that the protein can be made from start to finish, even if it is still missing some of that genetic instruction in the middle, let's say, of the protein. So they'll make a smaller and hopefully functional version of dystrophin if they're candidates for this. And we're probably up to, I don't know, probably a third of boys, I would say, are candidates. Would you agree with that?
I do, yeah, 1/3. And I think I also want to point out that someone is, eligible for exon skipping agents, that doesn't automatically exclude them from gene transfer therapy as well.
Yeah, that's right. So we're getting into the nitty-gritty of it, because it's such an exciting time to be a neuromuscular doctor, because we are getting into the era of gene therapy. And